Well, I guess we're going to, yes, we're probably going to have to rely on the chat option in order to deal with some of the interaction among council members. So let's, I'll really try to watch that. And then when we get to the last half of the agenda, which, as you know from looking at it, is having each of us share what's sort of going on in our own worlds. At that point, I'll just go through the list of council members and just ask you to speak, and hopefully you'll then pop up on the screen. But we will see how this works. All right, so I'd like to call to order the meeting of the Oregon Early Learning Council for April 9th, 2020. And welcome all of the board members who are on, even though we can't see one another. And welcome staff, because I know many of you are joining us today. And also welcome those of you who are online from the public and many of our partner organizations. So thank you for being on this call. My understanding from Remy is that we have no public testimony that has been submitted. So we will just move on then with the agenda. And Remy, will you just call the roll?
Yes. Angie Blackwell.
Present.
Katie Brooks.
I'm here.
Peter Buckley.
Here.
Ann Kubish.
Here.
George Mendoza.
Here.
Awesome. Peg Miller.
Yeah, Peg indicated that she may be signing on late. She's tied up at the hospital helping deliver a baby. So first things first.
Eva Ripito.
Here.
Cleathorne Ladd.
Here.
Sue Miller, chair.
Here.
And then we have Pat Allen, director of the Oregon Health Authority.
Here.
Colt Gill, director, Oregon Department of Education.
Remy, are the directors on, or are we?
No, I was just going through the roll call in general.
Yeah, I think all the directors are excused from today's meeting for lots of reasons.
Yes.
Except for our
except for Miriam Calderon.
Present.
Present, yes. Okay, thanks, Remy. So as you see from the agenda, we're going to be able to hear from Miriam this morning and her staff as far as an update on what's going on with emergency childcare. We've left lots of time for questions and answers so that we can really understand what's happening on the ground. And then we have time for the last part of the agenda where each of us will be able to talk about what's going on in our own worlds. And as I was thinking about this meeting last night, I just want to make a couple of comments heading into this. I was thinking about our last council meeting, which was only 2 months ago. I'm sure it seems like years ago in many ways, and what we were talking about 2 months ago. And when we met then, you know, we were focused on implementation of our strategic plan, Raise Up Oregon. We were full speed ahead. We had identified 2 priorities. We were going to focus on workforce and focus on how to strengthen the state and local connections. And we were very excited about being able to roll those out and really, yes. make some progress there. We also talked and heard an update about the Student Success Act and how exciting that funding source would be. And because of that update, we were able to release 3 or 4 requests for applications, RFAs, to continue to expand and enhance the services to young children and families. And we chartered our first advisory committee, Early Care and Education. So for 5 weeks, the staff was full throttle, getting ready to support us in implementation of those decisions that we had made. And then, as we know, March hit and everything changed in all of our worlds. And this isn't unique just to the early learning division, but it has obviously had a dramatic impact on all of our lives. And I think one thing that we know, and I have certainly seen, is that there's no easy decision, or at least I haven't heard of any easy decisions. And in fact, some decisions that we may make today, in a week or 2, may not look as if they were the best decision, because things are changing so fast. So I think having grace or flexibility in this time is really, really important. I think we all know that everybody on this phone call is probably working 16 to 18-hour days. So there's going to be some just sleep deprivation, probably family deprivation, emotional exhaustion, and the list can go on. The good news, as I'm thinking about this, is that we're all in this together. And it's not just those of us on the phone, but it's the businesses, nonprofit organizations, public and private groups who are stepping forward and trying to figure out, how do we navigate this new world? We're going to create new ways of doing business. Providing services, collaborating, finding partners. And fortunately, we have a council that is filled with people with creative ideas and networks throughout the state. So we're going to be able to help guide and also support staff in the ELD and in our partners. So there have to be some silver linings in this very dark cloud, and working together, we will find those silver linings. So with that, I'd like to turn it over to our fearless leader, Miriam Calderon. Thank you for everything that you and your staff are doing, Miriam.
Thank you, Sue. It's so great to see everyone. I think we determined that last time we did use Zoom, and this time we used GoToMeeting webinar. So I think that's our challenge. And Sue said we're all learning how to work virtually and remotely, so we will continue to improve upon this. But thanks, Sue, I'll watch, I guess if my, Remy, if you could help me watch the chat box if there's questions. I just want to go through and give an update, and I'm going to ask Amy Joyce to join us to talk about the status of emergency childcare. I know she's pulled some data together to give you an update on where we are with capacity around the state. But before that, I just want to say just kind of the unprecedented moment, I think, and challenge that we're in. It's been about 2.5 weeks since the governor's executive order and her directive to stay home to save lives. As you all know, childcare was ordered closed as part of that. Licensed childcare was ordered closed, and we moved into a situation of providers registering and making the decision, going through the difficult process of deciding to close or to transition to emergency childcare under different guidelines, not the least of which guidelines to think about the safety of themselves, their staff, and the children in their care. I think it's an interesting moment because as we have seen a lot of our society and our daily lives and businesses close down, we have realized that you cannot completely close down childcare. It is absolutely an essential service that children and families and our businesses in our state rely on. And so this is really the intense challenge because we are, while we say and recognize childcare as an essential service, we know that we are asking a lot of our childcare providers and that community. We have asked them to ask families to stay home unless they absolutely must use childcare. We know that many of them, our providers and their staff, are afraid. They're afraid about their own safety if they continue to provide care. For those that are closing, they're worried about their economic future, the future of their businesses, how they'll be able to provide for their own families. We know this is also a very intense period of sacrifice for the families who rely on childcare. Some are paying childcare providers that are closed. Some are working, still working from home, working full time, and trying to balance that reality with being able to care for their children, support their children in their ongoing learning and their ongoing well-being and health. We also know that there are thousands of families across our state who are still going to work. The understanding of what is essential work and who are all of the people that are showing up, particularly our frontline hospital workers, people working in our healthcare system, working in our grocery stores. Just there's a range of people in our state who are afraid, who are still going to work or are depending on emergency childcare and worried about whether their children are losing opportunities to learn because of school closures or such. So I think it's a very difficult situation, and I'm sure one that you all know well and understand and have been seeing firsthand in your communities. So I just wanted to say that I feel like now more than ever, we have to hold on to our values and some of the work that we were doing prior to this crisis around strengthening the childcare system in our state. And that really needs to be our compass and going forward. We have to remain committed to the health and safety of children in care, as we always have, and the health and safety of the people who work with children and their own well-being. That means being committed to appropriate working conditions for the childcare workforce, compensation and support. You know, that hasn't changed. We have to stay committed to the important role of childcare in school readiness and the importance of childcare being high quality, developmentally and culturally appropriate. This is not the moment for custodial care during a crisis. And we have to continue to be strong voices for that. And we have to continue to be committed to a system that is affordable and accessible for families and is more equitable so our families can access the childcare that they need. So I just wanted to say that, you know, within this great, very difficult, challenging moment that I think families and providers find themselves in, we really need to remain kind of vigilant to the things that we were working on before and those values, because we need them now more than ever to get through this and to make sure that we have the childcare system that we need in our state for the recovery effort as well as to get us through this moment. So thank you for letting me talk a little bit about that context. I'm going to turn it over to Amy, who's going to update you on the status of emergency childcare. And then I want to come back and talk about the draft proposal and the background that we shared with you about the federal funding that is coming to Oregon through the CARES Act. So thank you. Amy, you want to take it away? Hi, Peg.
Sure.
Good to see you.
So good morning, everyone. Amy Joyce, Office of Childcare Director here. And I put together a couple of slides just to help walk you through what we're doing around emergency childcare and then some of the numbers. So next slide, Remy. So we have three types of emergency childcare. And I will say this is independent of the sort of, unlicensed family, friend, neighbor, 3 children or less kind of care that's going on. But apart from that, we have 3 types of emergency care. So we have emergency licensed care, and this is folks who were licensed, certified prior, based on the governor's executive order and Miriam's temporary order fleshing that out. Basically, licensed childcare was required to close unless they applied to be emergency care providers. So that's one method. There's emergency school-based care. Again, the governor's directive to districts to open childcare, slightly modified, I think, yesterday in terms of, where it's needed, where there's a demonstrated need, they need to be opening school-based care, and the nuance there is it's located at a school and also operated by the school. And then the third form is emergency pop-up care. This is something we established before the March 24th second executive order, where we were seeing a real need and hearing about a need, particularly around medical professionals needing care. And so we established this method, which was for providers who could demonstrate that they had substantial experience in the child care field, could establish what we're referring to as a pop-up child care facility. They didn't have to have been licensed prior to that, but they did need to meet some basic standards, and again, be operated by a person, an individual, an organization with significant child care experience. So this could exist at a hospital. It could exist in a school being operated by somebody else, not by the school, that sort of thing. So those are the 3 overall types, and then I'll drill down just a little bit on each of those. Remy, if you could go to the next slide, please. So for all of these types, there are some basic requirements, again, based on the governor's executive order and Miriam's follow-up temporary order. So no more than 10 children in a stable or consistent group of children. Prioritizing the essential workforce, so medical professionals, first responders, but then also anybody who qualifies in that essential workforce, which can include, grocers and truckers and all the folks who we need to keep the essentials of society moving. And then thirdly, abiding by the Oregon Health Authority approved guidelines around, particularly around sanitation and that sort of thing. So those are requirements for each of the 3 types. Remy, next slide. So, and then drilling down just a bit on each of those 3 types, the emergency licensed care. So they had to have had a current valid license, and this is either center or family-based care. And then in addition, they also had to have no real concerning issues in this time of somewhat lowered oversight. So, for example, a licensed care facility might still be open, but might be operating under conditions, or might be operating having had civil penalties assessed against them and additional extra oversight. So some of those folks, this is just really a handful, but who had a license prior, and that we've said, no, you are not, suitable for this emergency care at this time. The second type, again, the emergency school-based care, again, at school and run by the school. Those really overseen by Department of Education, background checks by the Department of Education through their normal process, and operated by folks who know how to care for children. And then the third type, the emergency pop-up care, again, run by an experienced child care professional, and this includes operations at a school, but operated by a non-school operator, like a Childcare or someone like that. So that's the overview of the types of care. And I will move to my final slide, which are the numbers so far. So for the emergency licensed providers, we've had over 2,500 applications. And as I look at my calendar, it's pretty stunning. We opened this on March 24th, so that's 2 weeks and 2 days ago. We posted an application and have had and processed through at least the initial steps through the pipeline, 2,500 applications. 1,830 of those or so have already been approved, and the processing of those continues. And already over 18,000, approaching 19,000 slots approved. To be clear, those aren't 19,000 vacancies, but for those entities, they have that many slots that have been approved as emergency care. Under the emergency school-based providers, we have 96, I'm referring to them as registrants or / applicants, because really for the school-based care for kindergarten and age up, they really don't have to be approved by our office. They apply or register, tell us how many slots they have, so we know where they are and what they're doing. And then the emergency pop-ups, 74 applicants so far, and we're processing through those. Again, they might be located at a school and operated by somebody else. They might be located at OHSU or at OMSI and operated by somebody else. But this pop-up care to accommodate emergency workforce where we thought we might have a dearth of providers. So that's the information I have for you. I welcome any questions that you have for us, and between Miriam and me, hopefully we can answer them.
All right. Are there any questions from council members about the specifics really around these types of emergency childcare providers?
I have a question. Can you give an example of what an emergency pop-up looks like? A couple of examples that are out there being used right now?
I had a similar question.
Let me just say one thing. I think because of some of our video challenges, if each of us, and I should do the same thing, can identify ourselves when we're speaking, then people will know who's talking. So this was Katie Brooks asking that question. Thanks, Katie.
Okay. Thanks, Commissioner Brooks. So examples include, so OHSU reached out to us very early on and indicated a need, and so they contacted an experienced child care provider who opened up facility right there at the OHSU campus. Several YMCAs have, normally they operate what are referred to as the recorded programs, so just, a couple hours a day, that sort of thing. And some YMCAs have opened up full-blown childcare with their experience as recorded program providers, but providing full-blown childcare for their communities. Boys and Girls Clubs. So working with Corvallis just over the last couple of days. And they, again, normally operate one of these recorded programs just a couple hours a day. And they are opening up, have opened up for full-blown child care in their community. So those are a handful of examples.
Yeah. Amy, do you have numbers as far as how many of those 18,867 slots are filled? Do we know that?
Yeah, I can speak to that. This is Miriam. Right now, our numbers are showing about close to 10,000 vacancies, or sort of available slots across the state. So we're working very closely with our resource and referral entities, and 211 is helping us track referrals, and our R&Rs are in constant communication with providers because we want to be able to have data available for families that are contacting 211 and seeking emergency childcare to be able to point them to a provider in their community that has availability. So we're seeing quite a lot of capacity within our, and the numbers I just referenced are of those to those 18,000. So of our licensed providers in the state. I'd also remind everybody that licensed exempt providers, so providers who are caring for four or fewer children, so our family, friend, and neighbor care, were not addressed and not ordered to close. So we know that many family, friend, and neighbor caregivers are continuing to be able to provide care. A number of them do participate in the employment-related daycare program, relative caregivers or other family, friend, and neighbor caregivers as well. So we do have some numbers from them, and they are, we're working with DHS to understand whether, they're open, remain open or closed. I just got a breakdown of the capacity. We have about 1,200 infant slots available across the state, a little under 2,000 toddler, more than 4,000 preschool slots, and about 2,800 school-age slots available across the state. And we are continuing to hear that even was had an exchange yesterday with a superintendent on the Southwest Coast who's been providing emergency childcare, and they have been seeing their numbers of children attending the program steadily declining. So I think what the situation is really looking like is that many families are doing as much as they can to be able to stay home, to keep their children at home, even when they're working. And we've, really ended up with many providers who are caring for fewer children and not full. So more providers that are caring for maybe 4, 5, 6 children, not the 10 that they're allowed to in a stable group. And in a way that may be a positive thing for the stem, for trying to stem the spread of the virus. At the same time, we know that's a very challenging situation for the providers financially.
Right. So Miriam and Amy, and Eva, I'll get to you in 1 minute, but looking at the chat box for a minute, Kali is wondering what percentage of slots of the emergency childcare are being used, if you have a sense of that.
Yeah, Kali, I would say it's, we're working on getting some better estimates of that this weekend, but I think back of the envelope right now, it would say probably around 50% or less.
Okay, thanks, Miriam. Eva, you had your hand up.
I was just curious about how many of the 70, thank you, Chair, and everybody for all of this. This morning I'm feeling a little emotional, so if I start to break up, just all of it. So of the 74 applicants of the pop-ups, how many of those have been approved? And then, yeah, and then I have an additional question, I guess, that goes with that. Are we able to figure out, or are you tracking or figuring out if like the pop-ups are in areas where we don't have other available existing childcare slots, or is there some sort of like tracking to make sure that we're not opening up slots, additional slots when there are already slots not filled?
Yeah, thanks for that, council member. So again, Amy Joyce here. So on the approvals, so I think only a handful have gone through the entire process and been officially signed off on. What I can tell you is, as this developed, we established a process by which one of our senior ELD leadership team members, Dawn Taylor, was processing these requests, and based on initial information from them, they were sort of given a preliminary okay to begin. Or I will also tell you that some of them we learned about, you know, for example, via the media. We'd hear about, you know, a YMCA was starting a childcare, and we'd sort of catch up with them on the back end. They were trying to provide a service to their community, and we're catching up with them on the back end to say, you know, these are the things you need to go through. But so we think that, you know, roughly that number are operating, and they're continuing to go through the paperwork process of making sure they are have all their, you know, proverbial ducks in a row. In terms of locations, we have not so far made these contingent on demonstrating a need for childcare in that area. What I will say is we have been discussing in the OCC leadership and also at the ELD leadership level of, now that we're a couple of weeks into this and seeing some of those, you know, high, you know, sort of vacancies, flat vacancy rates, you know, I think we are rethinking about whether there should be criteria around demonstrating a need in that area. But I think, you know, this situation is so fluid. I think we're trying to gather this data. We're still only, like I said, we opened up the emergency childcare just over 2 weeks ago, and trying to understand the capacity. But I think that is actively being discussed in terms of, do we need additional criteria on those pop-ups to say, look, maybe these should only occur where there's a demonstrated need. So that's, in this very fluid environment, that's certainly being discussed.
Yeah, I can
Amy,
add.
about the pop-ups, there was a question about whether they require health inspections for the pop-ups.
Yes, they do. There is a checklist for these places, and we are doing, for almost everything at OCC, we are currently doing virtual visits, except for those situations where we have, you know, a complaint or situation where there's a safety concern, and I'm talking across all childcare, not just the pop-ups. We're trying to do virtual visits to keep that social distancing and honoring that requirement. So we are doing virtual visits with the pop-ups and going through that health and safety checklist, yes.
Okay.
I also wanted to add, I think this might be a good time to reference guidance that came out yesterday from the governor's office and the Oregon Department of Education and ELD around school-based emergency childcare. So schools are now going to be required and responsible for opening up an emergency childcare facility if needed, if there is unmet demand in the community. So we're going to be collaborating with ODE to be able to monitor, you know, where we do have unmet need for essential workers, frontline healthcare workers, and then schools will have 3 days to be able to work with ODE to establish school childcare for school-age children. And if there is a demonstrated need that can't be met for birth to 5 care in that community with experienced providers, then schools would be able to offer that in partnership. They providing the facilities, meals, custodial. So I would just ask everyone to take a look at that, because I do think that that policy guidance for schools is in recognition of the fact that we have a lot of experienced providers and capacity in the community, and that really schools also have increased responsibilities with distance learning and other supports, continued meal service, and other ways they're serving their communities. So I think this will be helpful in really being able to not make that ask of school districts unless it's an absolute need in their community, and will allow us to leverage our experienced providers who have stepped up and offered emergency care. I also saw that Anne posted a question in the chat box about capacity in rural communities versus urban. So I wanted to say thank you for that. That's a great question, Anne. We're right now we are seeing that there's capacity, there's availability in rural communities as well in our urban communities. I know we in general have less supply. We don't have enough supply across the state, but less supply in rural communities for sure. I just want to give you an example. We were looking at some data yesterday on sort of Columbia County has 257 available slots. Coos has 136 available slots. So we are continuing to monitor the situation, and if there is a need for care, we will, again, we have a couple of different tools with what Amy's described, the schools or other experienced providers and pop-ups. We've also reached out to every provider, early childhood educator that's listed in Oregon's registry for early childhood educators. About 700 have indicated that they are willing to serve as a substitute in an emergency childcare program if needed, or willing to provide care in the home of somebody if needed. So again, that's another resource. They're functioning right now as a substitute pool for emergency childcare providers, but also individuals that are willing to work in the home. So I think there was also a question about how are we monitoring kind of the demand. We have a survey that we collaborated with the emergency command center that's been stood up at the state that is going out. We can make sure council members have this. You can feel free to, this is a survey for families to indicate whether they need care or not. They still have to sign up even if they fill out the survey for emergency childcare by calling 211 and finding a provider. But this is helping us get an ongoing understanding of demand. And then our resource and referral entities are also available to be able to work with any employers or individuals. So families are being directed to 211 to help find an emergency care provider in their community. But R&Rs are staying in close contact with providers, as well as providing a lot of support to businesses or employers or people that are contacting them and saying, where is childcare in my community? What's available?
Okay, Miriam, I'm going to just do one more question on emergency childcare, and then we need to move to the Federal CARES Act. But last question on this is whether you or Amy have any data on the cultural representation or distribution of the child care providers, the emergency ones.
So this is Amy again. I don't believe that we're collecting data on, kind of demographic information like that. So I don't, can't speak to that. Miriam, can you?
Amy, and we don't typically at the level of the sort of a provider's application, I don't believe ask about race or ethnicity. Oh, hi. But I do know and can say that we have been working very hard to make sure that all of this information for providers around emergency childcare is available in multiple languages. Our licensing staff have been going to doing its particular kind of one-on-one assistance and support for our licensed providers to be able to submit the emergency childcare application and understand the requirement of closure and then the new requirements. So we're translating all of our guidance in the 5 languages that we do as quickly as possible. We actually even extended the deadline for submitting your emergency childcare application because we were not able to get all of the application translated into all of the languages other than English that we typically do in a timely manner. So I think we can go back and look at maybe some creative ways that that data, how we could figure out some data around the race and ethnicity of the providers that have submitted an emergency childcare application. But we are doing as much as we can on the front end with the sort of accessibility and really, I think our licensed providers who speak other languages and who work within our communities of color and rural communities have been doing a really important job. I know we had some licensing specialists dropping off applications for emergency care in providers' homes. You know, we had a lot of barriers to get over, not having fax machines or scanners and things like that. So I know I'm going to wrap it up soon.
Okay, we've got to get to the CARES Act, and then because I want to make sure we've got time for the end of our agenda, and we are almost supposed to be done with your entire presentation. So
Okay.
and I want to make sure that council members saw the information that was, and it's posted about the Early Learning Division proposal for childcare support and the CARES Act funding. So we have that information in front of us, which I think is sort of a snapshot of what Miriam wanted to cover. So let's move to the CARES Act. And
Okay, great. Thank you, Sue. So I will be brief. I'm sure council members, I don't want to reiterate a lot of the things that you were able to read. I also want to mention that I believe my colleague Dan Hahn, the director of the self-sufficiency programs at Department of Human Services, is on the line as well as a panelist. So I think he is not muted. And so Dan, I thank you for joining, and I invite you to definitely jump in here. We have been working very closely with the Department of Human Services since this emergency started to make some immediate changes to the employment-related daycare program so that we could enhance supports to low-income working families in a couple of ways that I'm going to cover. And so what I want you to understand as we kind of go into the CARES Act is this is a proposal right now for use of federal funds that were included as part of the third stimulus bill, federal bill for COVID-19 response, the CARES Act, and this money is coming through by way of the Childcare Development Block Grant, and we are expecting to receive about $38 million in federal CCDBG, Childcare Development Block Grant resources for the state of Oregon. So the approach here is twofold. One, it is to be able to maintain a number of the changes we've made to the employment-related daycare program to help to provide financial assistance to emergency workers and to be able to reduce payment burdens on families that are participating in the program. So there are 3 changes to employment-related daycare right now. These are temporary changes. One is we've increased the income eligibility to 85% of state median income, or about 250% of federal poverty, whichever is greater. This will support more essential workers and being able to qualify for child care assistance. To give you a perspective, that's about, I think for a family of 3, an income of about $5,000 a month. The second change is that all co-payments are waived for families during this emergency. The state is picking up the portion of the family co-pay obligation. And then the third is that through the month of April, employment-related daycare payments are going to continue to be made for providers that are closed. Providers are being reimbursed for increased days of absences, right, beyond normal. So if children are sick and they are not attending, the provider is still getting paid, is still getting payment. So those are the changes for ERDC. And then the new grant program that I want to talk about would be administered by ELD. So the self-sufficiency program. Yeah.
Sorry to interrupt you, but let me tell you, basically you've got 5 minutes to cover the rest of this.
Okay.
And once again, as I say, we've got it in writing in front of us if people look at the document from last night. Okay.
So the new grant program would be administered by ELD. DHS will continue to administer ERDC. And I think you've seen the sort of highlights there. The new grant program would have 4 components. Employee recognition funds would be provided to address compensation for staff working in emergency childcare programs. We would also make resources available. The second category of funding for this new grant program is funding for operational costs. So this would be supplemental funding on top of private pay, tuition, or ERDC payments. The third category is tuition support. So this would be helping providers get reimbursement or help get reimbursement for families that don't qualify for the employment-related daycare program or other priority populations like families involved with the child welfare system, foster families, or private paying families that are facing hardship. And then the last component is program sustainability. These would be resources to help providers that are closed cover some of the sort of loss of tuition costs. So that's at a high level the new grant program. I'll say we haven't yet received notice from the federal government about the availability of these funds, and so we're still working through kind of the timing and rollout of this.
Okay, thank you, Miriam. Wow, I know this represents a ton of work and still more to be done, obviously. So, and we can incorporate questions, I think, as we go, but what I'd like to do is really pivot to at least the highlights from council members of what's going on in your worlds around childcare and response to COVID-19. And I think I'm going to just go through the roster so it's alphabetical. And ask you to share your comments and your experiences. And we'll start with Angie from Grand Ronde.
Thank you, Sue.
Yeah.
Thank you. For the record, Angie Blackwell, Confederated Tribes of Grand Ronde. So the tribe declared a state of emergency back on, I think, March 17th and closed our campus to non-essential employees. And in doing so, they also closed Spirit Mountain Casino subsequently. And fortunately, the tribe is really dedicated to taking care of the employees. So they issued 3 weeks initially of unpaid leave, or paid leave to our employees, which is more than 2,000 people. Since then, they've added 3 more weeks. So we're closed at least for 6 weeks total, and employees are all being taken care of. So my program, which is Head Start, Early Head Start, Preschool Promise, and then Childcare, is closed at the present time for on-site services, but we're doing a number of things to offer services to children and families, whether it's child development and curriculum, or it's families' critical urgent needs like food insecurity and other things. So we still have staff working a variety of hours. Some of them are working 10 hours a week and some of them are working 20 hours a week, but we're delivering food. We're delivering physical packets to families for work, for parents to do with their kids at home. We're also doing Google Classrooms and a number of other things, really focusing a lot on social emotional learning right now and supporting parents and adapting to this new environment that some of them are working from home too, trying to juggle their children at home and doing their jobs. So we also have a lot of our partners that are stepping up and offering recorded curriculum. Our cultural education department is doing developmentally appropriate curriculum for our children. Our dental hygienist is doing the same thing she would have done in class, but she's doing it on recording, so we're able to release that. The only other thing I want to add is just that with yesterday's announcement about K-12 schools, it's really up in the air what's going to happen with our program. We're a year-round program, so we wouldn't have closed in June like most schools. And we don't really know. We have a lot of parents asking, as soon as that announcement was made yesterday, what's happening with our program. And we don't have the answer to that yet, but we do hope to open before September. And then just regarding emergency childcare, I want to address that very quickly. I am interested in willing to do emergency childcare. We haven't demonstrated that we have a big enough need in Grand Ronde for it. If and when we do document that, I know I have plenty of staff that will be more than willing to come into the program and provide that service for those essential employees. We do have a health clinic that's operating full time. Of course, we have our sanitation workers and we have our public safety workers. So something that I'm interested in doing, but we're not at this present time.
Okay, thank you, Angie, for that great update, and how wonderful that the tribes can support your workers that way.
Very fortunate.
Thanks, Angie. Peter Buckley down in Southern Oregon.
Thanks, Sue. It's been very busy here like everybody else. The effort to bring online emergency childcare has gone well. Our Childcare Resource Network, our Early Learning Hub, the Southern Oregon Education Service District, and school districts and the YMCAs have all worked well together to get programs up and running. We have pop-ups in Grants Pass, Central Point, Medford, and Phoenix Talent, I believe. YMCA has been a great partner, as I mentioned. We are finding, like I think other areas around the state, that we have more capacity than we're currently using right now. So we are doing outreach to our healthcare providers, to Asante and to Providence and to our federally qualified health clinics, just to make sure that their employees know that the service is available. So we're going to see what happens as people kind of take in the information that school is now closed for the rest of the school year. So a temporary child care situation might evolve into needing more permanent child care through the emergency child cares that we have established. We're working with all the school districts in the region to make sure that they will have a plan in case they're called upon to offer school age care. And probably the most uplifting experience we've had was a member of the Medford Rotary Club had called, I believe, Miriam and Sue to talk about the possibility of Rotary offering their support for early childhood. What is a child care need? And we were able to get a conversation going with Miriam and Sue, the Rotarians, and some of the folks here working in early childhood. They are investigating the opportunity of recruiting Rotary members really from a very large region. Their Rotary region runs from Northern California up to Salem, over into Central Oregon as well. The idea being that Rotary members would volunteer to be financial coaches for child care providers who need assistance applying for federal funds, or even their ongoing business practices, dealing with unemployment issues, things like that. So we're cautiously optimistic that we'll be able to join with other areas of the state. I know there's a similar effort going on in Multnomah County. Hopefully we could get a system going where we can match financial advisors with providers, both on a short-term and a long-term basis.
Awesome. Thank you, Peter. And doing that crossover among regions will be really, really helpful, obviously. Katie, speaking of Central Oregon.
There we go. So we're working on a similar model that you circulated, Sue, on trying to stand up a advisory tree, for lack of a better way to describe it, for our childcare providers here. And Peter, I had heard about what the Rotary did in Southern Oregon, and I've asked our Central Oregon childcare coordinator to look into that to see if the Rotaries here are interested as well. Obviously, nobody's meeting, but we do have ways of getting in touch with them. So we're looking into tapping into ESD funding from Better Together, which is a subset of the ESD to help youth succeed. And they're thinking about helping to fund that effort. So that is proceeding as we speak. In other things that are going on, just from the chamber standpoint, the business aspect of what's going on, and the train wreck that's happening in front of all of us, our organization partnered with OSU Cascades to put up a regional website called centraloregonsos.com. It has 3 sections, one for business owners and employers, another for employees, and another for community, trying to provide connection to funding streams, information, and other stuff that will help through the crisis. And one of the things that we've included is all the information about childcare. We're trying to get as much assistance to the childcare providers who are applying for the federal grants as possible. And we're trying to figure out if we can use some of the childcare directors in the centers around the region to help in that effort and employ them during this time as part of the consulting tree. And I'll tell you another thing that my head is going to, might be premature, but maybe not, is what happens when we come out the other side of this. And I'll tell you right now, in looking at the numbers that are coming through the banks for SBA loans for the PPP program, that childcare providers, they have different relationships with their banks. It's harder for them to get the money. And my fear is that they won't be at the top of the line, and that the money is going to go out to other businesses and not to these people. So I've reached out to some folks in the banking industry to have that conversation. They are truly doing the best they can. 26,000 applications in a day or two from one of them, and over $6 billion worth of asks just for our region. So it gives you a size of a sense of the size of the whole. It cannot be filled. And so I've gone from triage into what does the other side look like, and trying to think about how do we deploy Wonder School and some of the things that are low cost, easily scalable when we come out the other side and these people aren't in business anymore. And somebody's got to start thinking about it, because I think that's what we're going to be looking at, unless some of this funding can stand them up. So those are the things we're doing in our region. There's a lot more. We started, just last thing, a platform called SOS, Mainstream Street SOS, and in Bend, it's SOS Bend. It's a direct consumer to business line of credit. So you can purchase future credit in your favorite business, whether it's providing goods or services like childcare. So people can sign on with their business and say, hey, I'm Katie's Childcare, and you can give me money toward future credit. So somebody could be inclined to give you $1,000, and then they know that they can cash in on that later. There's risk with that because there's no guarantee the business will be there. But this group of software engineers and companies and venture investors and I have been working on this in the last 2 weeks. It'll start up next week. And it's the only thing we could think of is just to get cash in people's hands in the short term. And then the businesses will have to decide how they manage their cash flow over time if people are buying future credit. But at least it'll get a little bit of money in people's hands. So that's what we're up to.
Great. Thanks, Katie. What an innovative idea. Awesome. Ann Kubich in Roseburg.
Hi, everyone. Can you hear me?
Yeah.
Okay. Hi, everyone. I'll speak sort of generally about the philanthropic response right now. I don't have a specific story to tell about childcare, but sort of generally, I think it's relevant, sort of the general response. What I'll say quickly about what we have done, we have made about $2 million worth of small grants to 250 nonprofits and community partners across rural Oregon. And a lot of those were about taking care of kids and families in terms of basic needs and so on. We are doing I don't have the research. We're currently compiling what people asked for in they had to fill out a really easy application that asked them, how much do you want and what do you want it for? And then second, tell us what else is going on in your community and what other needs you have. And we are currently going through that research because we have 250 applicants and we were so busy getting the money out the door that we didn't actually even look at what they compile the information, but we will, and I think it'll be really interesting. We also gave awards, we're giving awards of $15,000 to each of our school districts in Douglas County. They've said that they need it for two things. One is for distance learning for the kids, which could be everything from Chromebooks to other teacher distance learning supports and basic needs, especially food, because a lot of the schools not just feed the kids, but also send the kids home with family food packs for the weekend. Another thing I wanted to say is that we, in partnership with the Oregon Community Foundation, the Oregon Community Foundation is already set up, and we are providing funding for it also, a small business stabilization fund, and it is precisely to respond to the kind of thing that Katie was just talking about, which is that we are really worried that the small businesses, either in urban areas and especially in rural areas, are not going to get, are going to be so low down on the priority list or the ability to access federal funds that, and so many of these businesses are either unbanked or so that they don't even have access to a bank to do this. They don't have the technical assistance to fill out the technical capacity to fill out the applications. And they are on such a shoestring budget that if they don't get funding in the next 2 weeks, they are going out of business. And so the idea is to provide a pool to support the intermediaries that provide technical assistance to the small businesses to make sure that they can fill out the funds, get access to them quickly. And some of the other things that we're doing is we're participating in our incident command in Douglas County to provide there's two branches of it. One of them is the medical response and the other is the community response, and we're helping with the community response. I do know that generally the foundation community has put money into a fund at the Oregon Community Foundation. I think there's about $6 million in there now for supports for nonprofit organizations. I think they have about somewhere between 5 and 10 times that amount in requests. So I don't know how they're going to handle all of that. And that the Grantmakers Association of Oregon and Southwest Washington has paired up with the Nonprofit Association of Oregon, where the Nonprofit Association is in touch with all of the nonprofits, and they're going to link up through a platform to the foundations so that there can be kind of a matchmaking enterprise that is web-based. So that's some of the things that the philanthropic community is doing. That's not specifically about childcare, but a lot of it does touch on childcare.
All right. Thank you, Anne. We appreciate what the philanthropic community is doing. It's a critical part of this response team. George Mendoza over in La Grande.
Everyone.
Good morning.
Morning. So same thing, and I guess in our region with everybody. Once we received word, our hospital system contacted La Grande School District and did want to see if we had support for their healthcare workers and emergency responders. So that was, I'd say, right after March 13th. And within a week, we met with them, met with emergency management team, met with first responder agencies like the fire department and police department, and kind of went over the parameters that we were first given with the executive order. And then from there, we completed a needs assessment to find out which families were in need. from 0 years old to 12 years old. And then we started to work with Head Start and Intermountain ESD to figure out the game plan for that. Head Start at that time didn't have enough information to be able to move forward or allocate any staffing. So Intermountain ESD, which is part of the ESD, did have executive orders to be able to help carry out preschool. And they then worked with us to use our preschool site that we already have for early intervention. And then we moved forward with having kindergarten through 12-year-olds being served at one of our elementary schools. And this last week, we started out having emergency childcare services for 5 to 12-year-olds, and then Intermountain ESD has been working with preschool.
And George, will you share the numbers with us that we talked about earlier? Because it's part of the earlier conversation.
When we first got the survey data, we had about 20 families sign up. And so we thought we would have around anywhere from 20 to 30 children that we would be serving. And then when we did phone calls last week to organize everybody and get everybody to show up, we found out that only about half of the families actually really wanted the service once we said, okay, now we're ready to offer it to you. And so I think what they had at first was 4 preschool kiddos, and only 2 showed up. And then they had 14 kids ready to go for childcare, 5 years old to 12 years old, and I think only 6 actually showed up for that. So the demand versus going forward weren't the same.
Yes, and as we've heard, that's pretty universal. Okay, thank you, George, and thanks for all that you're doing as running a school district. Challenging times.
Yeah, thank you.
Peg Miller.
I am kind of out of the loop with childcare, been busy with other things.
Well, we're happy to hear what you're busy with. So
we're just kind of anecdotally working with lots of healthcare providers. It appears that people are finding providers, or that their providers are still open for them. And some of them I've asked have applied for the emergency grants and so forth. My particular concerns, and I'll be very brief about it because I know that's not our function here today, but my concerns really are with regard to child abuse. And I think we're in a time when we're really at risk, when kids are really at risk because they're kind of invisible right now and families are really under stress. And I think we all need to have a heightened awareness of that. I'm not sure I have a good solution to that. We have continued to keep our Child Abuse Assessment Center open, although are operating under different parameters than we would ordinarily operate, but hoping to still be able to assess those kids that really need acute assessments. I guess my other concern is with regard to foster families, that I think foster families are particularly stressed at this time because they oftentimes have really high needs kids and have been dependent upon many services that now are having to operate distantly. So again, I'm not sure I have any solutions, but those are my big concerns at this time. Thanks.
Yep. Thank you, Peg, and thanks for the work you do with Juliet's House and that whole child abuse assessment and prevention. Yes, huge concern. Eva Rapito.
Hi. So much. The kids, when they popped on, they noticed you, Dr. Miller, and they were like, "There's a doctor in your meeting." Like, yes.
It made me smile too. It's good.
Yeah, they pop in every once in a while. Kati's currently right outside beating the bushes with a large stick. So if we hear some screaming, we know what else happened. Thanks everybody for sharing all that you're doing. Katie, your call out for our, providers, my colleague who does the representation work with our in-home providers, said, yes, preach, Katie. Thank you for calling out the specific needs of how childcare are not getting access to the emergency funds. A lot of them have been finding that as they go to apply for things, it's already too late. And even though we tried to get them the information as quickly as we could, those who are more practiced at such things were able to access these funds a lot faster. And some of the other things that we've encountered or heard from providers that haven't already been discussed is that I guess the way that they've structured their business, even as self-employed, they're being denied for unemployment insurance, and we're not sure how to answer those questions. So, if we could have an FAQ put together for those of you who are business savvy, that would be really helpful. I don't know if there is a way to, we don't, that's something that's outside of the union's wheelhouse of, helping self-employed apply for unemployment insurance usually. I mean, I guess it's outside of a lot of our wheelhouses at this point. And for those who have stayed open, it's scary because they're weighing the risk of, a higher risk of, getting, bringing illness into their own homes with their financial need. It's a horrible, this whole thing is horrible for everyone. And when your income is opening up your house to other families, it's a heart-wrenching decision to decide whether or not to stay open and put you and your family at risk, and then all the children that you care for at risk. But then also knowing that not doing so puts you at a financial risk. So a lot of our providers have been struggling with that decision-making process as well. And then been, really appreciative that, they have opportunities to stay open if they choose, and then not having the business come in. On the flip side, for the people who, or for all the providers, whether they're open or not having the guarantee or some sort of source of stability if they didn't have employment-related daycare families that they were caring for, or if they had just a few, that not having some sort of slot guarantee for those private pay families or spots has been really rough. So I would have one ask. If we've been doing a landing page for our childcare providers where we're putting, housing stability information, because, we have providers who are renters, providers, who are homeowners. So we're doing all of that. So any sort of web pages that you're sharing for resources or phone numbers for coaching, if you could pass that along, we'd be happy to post it on our landing page.
Okay, great. Thank you, Eva. And we understand this hits very close to home for all of us, especially for you. Kali Thornlad.
Okay. Can you hear me?
Yes.
Okay. I'm gonna have to read a little bit of this. I think in terms of in my immediate universe of Kairos, I think one of the things that I'm most concerned about is the social emotional well-being of children right now. I think there's a lot of emphasis on the academic pieces and how do we ensure all children are learning, but there is this huge social emotional impact as well that has an impact on their learning. And this is a huge event in the lives of everybody. And so just making sure we're caring for our children and that families and caregivers have the tools they need to support children. They're not rocket science, but I do have concerns that information is not getting out. How do we just support children through this across the age continuum? And the younger they are, the more important it is to have that support, because that foundation that is a roadmap to their lives is being made. So that's a big area of thought for me. And we have been doing a lot to try to figure out how we create the materials that can go out into the universe to give people information, families information about how they can support their children. So that's one big thing. My eyes are gonna be reading off of my screen, so bear with me. In the Portland metro area, there is a group of folks, the Childcare Project, that is a lot of advocacy groups, the Momentum Alliance, New Oregon, PALF, Unite Oregon, Oregon Futures Lab, Family Forward, PCUN, and they've all been focused on how do we support our historically underserved families. Those are all organizations that serve predominantly or advocate predominantly for children of color, and just concerns about the disproportionate impact that COVID is having on communities of color. We've heard a lot of reports in the news recently about this, and they are focused on, I saw Remy said something about EDRC, but just not enough relief for the families. A lot of the frontline workers are people of color, and there's still sort of the burden that they have of paying for emergency childcare. Not everybody's getting access to different waivers and sort of relief on the payment side. There's also a real concern that we're going to lose a lot of the providers. And as I think Sue said at the beginning of the meeting, we may come out of this and some providers will no longer be standing, or maybe it was Miriam that said that. But I think there's a big concern that providers that are people of color are in particular not going to be there, and how important they are for our communities of color. And so ensuring that we support the women and minority owned businesses that most of these childcare providers are, and the city of Portland has put a lot of work into supporting small businesses, but there's a feeling that childcare as a business has been left out, and so a lot around just supporting these most vulnerable communities. And then also, I continue to sit and participate on the Preschool for All committee, and that has been focused on a county-wide measure that would allow for publicly funded preschool. There was a meeting last week, and there is even more concern now that the landscape has changed so much that the number of slots needed is going to be larger than what they forecasted. And so just, the sense of need being so great right now, and the vulnerable populations, as everybody here has already articulated, being the ones that are going to be most impacted, and then what? And so really wanting all the resources, state, federal, to not forget having an equity lens and thinking about these communities. We have a lot of immigrant communities, refugee communities, and hearing from a lot of them as well, and feeling really disconnected from the resources that are out there. So. Yep. That's my update.
Thank you, Kelly. And my update will be that I'm just trying to stay connected with all of you, but also we'll send to you, Eva, a link to an organization that Katie has mentioned, and Peter, where we're trying to find financial advisors to support childcare providers in applying for these federal funds so that they get access to the funds. So I'll share that information. Last thing, and I'm sorry we have run over, obviously, but as you know, we distributed a resolution that I am very hopeful the council will pass before we adjourn I was going to read it, but we do not have time to do that. And it was posted on the website. It was sent out to all of you, basically just saying there's lots of good stuff going on and there are lots of challenges, and looking ahead to trying to have cross-sector support as we support an early learning system that is certainly at risk, and also that we look at a longer term plan, which many of you have commented on today. We're going to come out of this, but we need to start doing what we can to plan for how are we going to make that successful. So I would love to entertain a motion to adopt the resolution as distributed.
This is Angie. I would like to make the motion to adopt the resolution as distributed.
Thanks.
I'll second.
And sorry, that was Eva?
Yes.
Okay, thank you, Eva. Sorry, we don't have much time for discussion. Were there any changes anyone would like to propose? If not, those in favor of the motion, please say aye.
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 Any opposed or abstaining? All right, if not, we will send this over to the governor and her staff. Thank you very much. Thank you, council members. Thank you, Miriam, and your awesome staff for moving through this. Thank you to the public who joined us today. And council, as you know, we have our regularly scheduled meeting for April 30th. So please keep that on your calendars. Obviously, it's going to be virtual again. We will figure out the platform before that. And I'm sure it'll be less than the normal 7 hours. So we'll try to hold it to probably a 4-hour period. And we'll get those times out to you, hopefully in the next several days. So thank you all very, very much. Stay well, and best of luck.
I have one last question. Can we
Yes.
get a list of the questions that were asked by audience, and so that we can maybe also see if there are questions that we can help answer or help connect people to resources?
Yes, Eva, I've been responding with Remy and kind of looking at the chat. So we'll definitely
Yeah, I've noticed
continue to.
that, but yeah. Thank you.
Thanks.
Great.
Okay. Thanks, you guys. Have a good
Thanks,
day.
everybody.
Bye-bye.
Thank you.